Hello, welcome back for another video. Today I want to talk about a syndrome called antiphospholipid antibody syndrome. And this is something that rheumatologists will often see patients for because they have a positive A&E lab test or a history of multiple blood clots or even a blood clot in the lungs called the pulmonary embolus. Usually a hematologist as well as a rheumatologist help manage this condition because it's something that we can see in combination with other autoimmune syndromes, particularly lupus. And part of the testing that results from this syndrome, there's a group of 3 lab tests that we check. One called lupus anticoagulant, which actually is not related to lupus at all, beta-2 glycoprotein, and anticardiolipin antibodies. And these 3 lab tests are checked 12 weeks apart from each other. So they really do need to be separated by 3 months to fully be able to diagnose a patient with antiphospholipid antibody syndrome. And ultimately what this syndrome encompasses is an increased risk for developing blood clots, either in the legs, which then can spread to the lungs. We call that pulmonary embolus. People who have had strokes, if you're particularly a young person with a stroke, meaning not somebody who has other risk factors like high blood pressure or smoking or known risk factors for strokes. And women who have had multiple miscarriages, especially if you have 2nd or 3rd trimester miscarriages, or maybe history of a stillborn child with an abnormal placenta that has shown blood clots, or if you have history of preeclampsia or eclampsia. Those are reasons to check for antiphospholipid labs. Other symptoms that can coexist with antiphospholipid antibody syndrome are a lacy, sort of what we call reticular rash. You can have sort of just a splotchy appearance of your skin. Sometimes people can get ulcerations, and Raynaud's can be a part of that. That's the syndrome where your fingertips change from blue to purple to white, especially in the cold or air conditioning or freezer section at the grocery store might be a time that you see it. Sometimes it happens with caffeine or stress. So those symptoms by themselves are not diagnostic of antiphospholipid antibody syndrome, but when we group a lot of those things together, that can be part of the criteria that leads us to testing you for this syndrome. So going back to the people who treat this syndrome, rheumatologists will get involved often, and we can use something called hydroxychloroquine or Plaquenil, which is also used in lupus and rheumatoid arthritis. And that just decreases the antibody's effectiveness of the blood, making the blood sticky and clumped together. So in a sense, it helps decrease the antibody expression of these antiphospholipid antibodies, which then can lower your risk for a blood clot. It doesn't prevent blood clots, but it can help decrease your blood clotting risk. And then if you've had a blood clot, or what we call a thrombotic event, then your hematologist will likely have you on anticoagulation. And the most common one that we use is Coumadin or warfarin. Some of the other ones are used, but the American College of Rheumatology guidelines and recommendations still do recommend the use of Coumadin or warfarin for antiphospholipid antibody syndrome. So I just wanted to bring this up. I know this video is a little bit shorter than typical, or my more recent ones that have been longer winded, but this is something that I've been seeing a few patients for, and we cover this diagnosis in the hospital. We do get called quite a bit to see patients with this condition, and it's just something that we want to pay attention to. A lot of patients with this diagnosis don't necessarily have a rheumatologist, and there really is a role for having a rheumatologist, especially if you're on Plaquenil. And we can just provide a helpful insight as far as, what else that we could be looking for. It is still important that you're screened for lupus if you have this diagnosis of antiphospholipid antibody syndrome. as there can just be other things that coexist with it along the way. So it is helpful to at least meet with a rheumatologist. So if you have concern about this, check with your primary doctor to start the screening process or start talking about the possibility for this. If you are somebody who knows someone with antiphospholipid syndrome or who has recurrent blood clots for an unexplained reason, or again, a young person, typically under the age of 50, 55, who's had a stroke, this is something that should be evaluated for. And then also, if you do have this diagnosis and you aren't following with a rheumatologist, then I'm in the Phoenix area. You can come find me and I'd be happy to evaluate you. But also, use this video to help advocate for yourself to try and meet with a rheumatologist in your area. All right, thank you so much. We'll see you next time. Please feel free to post any questions or comments. I'd be happy to answer the best I can. Thank you.